Just firstly, in relation to the opening statement given by yourself, Mr. Gallagher, there, just from the National Treatment Purchase Fund, you say that the NTPF first learned of the internal CHI report outlining the misuse of NTPF money at CHI. Do you stand over that comment that there was? Is that an established fact in your view that there was a misuse of the funds?
No, it depends on at that point in time, that was our then belief. Do you want to add to that?
So, Deputy, when we learned about it in the Sunday Independent, Sunday Times, we were very concerned because the allegation was there of misuse of funds and we knew nothing about it. The following day, I liaised with Ms Nugent and we had a conversation in relation to what the issue was. I made a request on the Tuesday then for the report just that pertained to the NTPF so we could get an overview. And unfortunately, Ms Nugent wasn't able to release that. And it was at that stage I wrote to her to say I'm going to stop all insourcing until I get an idea of what we're talking about here.
Okay, but just that particular word, use of that word in your opening statement, where you don't say alleged misuse, you say the outlining the misuse of NTPF money. So it is misuse, or
No, Deputy. When I got a copy of the redacted reports that just pertain to the NTPF, I reviewed it in detail and I realised it wasn't a misuse of the NTPF funds.
Okay. Can I just, Ms Nugent, the last time you were in, you weren't aware of this unpublished internal review at that point, and you stated that the first you heard of it also was in the media over the course of the week.
When there was a media request came in on the Friday night, Saturday. Okay,
so you were blindsided by this, it would be safe to say? Yeah, absolutely.
Since then, though, I have asked all of my executive colleagues and my consultant colleagues if there are any other reports outstanding that I need to be aware of.
Okay, and are there any?
There are some minor HR ones. There's some actual reports where staff have sought the intellectual expertise in planning for the new hospital, but I don't think that's relevant to what we're talking about here, but it was good to see.
Okay, and Ms Hardiman, obviously as part of that internal process, have you been asked as to whether there's any outstanding HR issues or reviews or reports that maybe in hindsight should have been brought to the current CEO or the then acting CEO? Is there any other?
No, I've shared with Ms Nugent.
Okay, so
thank you.
So we're no one's going to be blindsided at any point.
No.
No.
Not. I think I've told her.
Okay, just in relation to the unpublished review, a number of deputies have touched on what triggered it. Was it a whistleblower? Was it staff that first raised the issues, or?
No, several members of this team were coming to several other members of the executive with issues. They seem to be predominantly operations, and as I said, we put somebody in to work with them specifically. She came back and said there is more to this than that. There are long-standing issues, and particularly team dynamics and unprofessional behaviours, that warranted exploration from a HR perspective. So that's why we assigned then somebody from a specialist from HR and operations, because we knew they were connected. And that's what led to the review. And we agreed the terms of reference with the team of consultants asked the staff to please just be open with us, because we know there are issues here and we want to address them. And that was the important trust matter. And I think that's where we actually gained their trust because we acted. And we followed up with the HR process. We put in the management intervention plan. We addressed the patient safety issues. We reported it to board. We took the issues up to the HSE, not the report itself, because we want to maintain it confidential. And I think I can confidently say that's a better service.
Those issues that you say you brought to the HSE, would it be possible?
And they helped us. Most of them were investment issues that we needed actually specific investment.
I suppose that review itself, the findings of that review was never furnished to the HSE.
It was never meant to be.
Can we get a copy of exactly what was sent and who it was sent to?
Yeah, the issues that we raised. Yeah, absolutely.
Okay, thanks for that. And just in terms of the particular individual who I think it has been stated that they were operating this system of working on a Saturday, not honouring their contract, and that was about 3 months in duration. Is that what?
Are you talking about how much they were signed off by occupational health?
Yeah, how long were they?
I'd have to find that.
We don't know how long.
Oh, that period, yeah, that was a short period. That was just the end of 3 months, I would say.
About 3 months.
Five clinics.
And
so
has it been established
days.
as to what the financial cost of that was? I mean, how much was that consultant getting paid or did get paid over that period of time?
The figure for working the additional hours, is it? Yeah, 35,000.
35,800 or?
Yeah.
It was actually slightly
It was
less.
slightly
It was
less.
actually slightly less.
Yeah.
Okay,
So
so
35,800 was approved in
35,000.
1924.
So that's over a 3-month period. So
For additional work taken,
additional
over
for
and above their core hours.
working
yeah.
on a Saturday over 3 months.
And
so
that's the arrangement of the insourcing that,
Okay.
that
So
has been referred to
you're looking at
across the system.
€3,000 a week, €3,000 approximately for is it?
£7,000 a clinic.
£7,000 a clinic. Is that how much per clinic was?
It's just the overtime paid to the consultant in respect
How much
of,
per clinic was he getting?
I don't know per clinic, but in respect of NTPF work over the period.
It was the hours worked.
Yeah.
The hours worked. Okay. And how much per hour would?
I wouldn't have that figure.
Could we
Get
get that
that in
figure?
accordance with approved consolidated
Pay
pay
scale.
scales.
Okay, can we get that
Yeah,
figure
sure.
furnished to us? And it's being stated here that consultant is no longer an employee of CHI. Just again, did that finish in 21 or 22? When did?
In 22.
22, and was that of that individual's own volition, or was that the result of a HR?
Yeah, we can't get into the specifics, but what I can say is that some staff did leave as through HR processes were actually implemented. Yeah.
Okay.
And others were, supported and developed to actually address, and in particularly there was like organisation psychologist support put in to get the team dynamics and support the team so that they could, function better as a team. So all of those supports put in and the relevant HR policies were actually implemented.
Okay. Was there any disciplinary actions taken on?
Some of those, yeah, that's what I'm talking about, grievance, disciplinary,
Okay.
all of those elements, yeah.
So
But I can't get into specifics because I
can't
think
get
that
into-
that would be unfair and potentially.
was it a mutual agreement, that individual leaving then?
With the HR process are the HR process, and you have to work through them.
Okay. Just in relation to, there was two different percentage figures given earlier on by the CNAG, and I forget who gave the one, just in terms of the breakup between the public and private. I think the CNAG said that figure breaks.
I mentioned 60-40, and I think the chair of NTPF mentioned 70-30
yeah.
in 2024.
Yeah.
Yeah. So I was talking about 2023.
Okay.
This
yeah,
was
no,
2024.
just to clarify that. No, thanks for that. Just in relation to the 27-month review in terms of that was carried out for insourcing. A figure of 100 million has been given across the HSE for insourcing. Do we know how much CHI for over that 27-month period for insourcing? How much has that cost?
Which year?
As part of, there was a review carried out by the Minister, and Bernard Gloucester, I think, made reference to it. He published that review.
Is this the one that was published on the 1st of July?
Yeah.
I wouldn't have the breakdown of the figure here with me. I have what we received from 2020 to 24 by year,
Okay.
if that's useful. So the total is 8655513. Do you want to get in? Sorry,
Yeah, no, from the NTPF, we received 8.6 million over 2020 to 2024 under access to care. We received 28.2 million from 2020 to 2025. And it was that expenditure which I believe was the subject of the report you're referring to.
Okay. And Bernard Gloucester and the Minister have also, at committee and reference, a number of members spoke to, I suppose, the winding down of insourcing, and they've given a date of June of next year for that practice to be wound down. There have been concerns expressed in terms of the ability of CHI and other organisations to be able to meet that deadline. Ms Nugent, June next year, and that practice, which I think, you know, has opened a lot of concerns and issues and pitfalls. Do you think that target is achievable?
That's something that myself and our new Chief Operations Officer is reviewing to actually see what is achievable.
Okay. Is it achievable, do you think?
I'll know when the review is done.
Okay, you might come back to us on that. Now, Bernard Gloucester also said there's an over-dependency on insourcing. Would you agree?
I think one of the challenges for paediatrics specifically is that there's very little paediatrics in the private sector, number one, and a limited number of paediatric hospitals in the country. So there is probably, it's slightly different to adult hospitals where there's more choice. So that is probably one area that insourcing has supported us in trying to reduce our waiting lists.
Okay, and audits being carried out on insourcing? What nature or how often or
so the NTPF would regularly carry out audits of all hospitals. So we had I think 2 in 21, 1 in 23, 1 in 24. But as also part of our own board assurance process, the internal auditor did an audit in 2024 that found that our waiting list processes were robust and in line with NTPF guidelines.
Okay, and just in relation, we got examples of 2 private hospitals earlier on, just from funding from through NTPF. Do we think it would be useful from a transparency perspective that all hospitals' figures receiving funding would be published and readily available? Ms Brady or Mr Gill?
It's not something we regularly do, Deputy, but I don't see why it can't be. I don't see any reason why we can't. And we have the figures readily available. Okay, well look,
maybe if you could furnish this committee with those figures, maybe over the last 5 years from 2020 through to the 2024.
That's all public and private.
All public and private, yeah.
That's fine. Yes, definitely we'll do it.
Okay, just to conclude, just briefly in relation to the hip dysplasia, and earlier on I think reference was made to surgeons, and I think Ms Nugent, I don't know whether I picked it up right, you said that all surgeons are still working, and then later on I think we were talking about Surgeon A then, who was out on gardening leave, so I'm not sure as to whether...
You are correct in that individual is on leave.
Okay, and just in relation to, I suppose, the hip dysplasia and parents being offered second opinions, and we have some of the figures in terms of families and children still undergoing review on that. How many parents or how many cases have sought a second opinion at this stage? Do we have any?
I don't have that number to hand.
Maybe
as an external to CHI?
Yeah.
Yeah. No, at the moment, obviously, we have, there's a process for the review and then there'll be the secondary commissioned expert panel. I don't have that figure to hand.
Okay. Would you be able to get that figure?
I can certainly, absolutely.
Okay.
Sure, yeah.
And just in terms of funding parents to carry out, to get that second opinion carried out, is funding being put in place?
Sorry, I know that Mr Gloucester and also Dr Henry said that funding would be made available.
It will be made available.
That's what they have stated, yes.
And just in terms of, you said you were looking at the, I suppose, all of those cases being reviewed as to whether there was a clinical need for the surgery to be carried out. Are you also looking at whether it was necessary to carry out the surgeries?
This is a HC commissioned review, and it's to assess the decision for surgery or not, is my understanding.
Okay, just to assess the decision for surgery, not to assess whether the surgery was necessary.
I suppose it's an interpretation of words, isn't it?
Okay. No, it's my understanding that surgeries, that families need to know whether the surgeries were necessary or unnecessary.
I
And
understand
think, you know, I think families are very unclear as to what that process actually looks like and what the outcome will be and what is being looked at. And I think clarity is needed on that front.
And Dr. Henry, in the Joint Oireachtas Health Committee with us 2 weeks ago, advised that the expert panel is being established, the terms of reference, etc., are being drafted, and that he's going to communicate that as soon as that has been finalised.
Okay.